Hi, Mary. Thanks for all your help. I hope this works. The following is an attempt to discuss the nature of various dysfunctions within the physiology, namely vata indigestion, frequent colds and allergies as a result of vata pradashaya, dry cough, and occasional vertigo. These dysfunctions are ultimately a manifestation of the far more subtle accumulations of Shrota-Shuddhi conditions within the Shrotas themselves. Vata balance is especially important for respiratory health. In fact, open channels or Shrota-Shuddhi are essential for the flow of prana within the physiology. Under normal conditions, where vata is balanced and open channels prevail, the lubricating and protective qualities of kapha work in perfect harmony within the micro and nano passageways of the respiratory system. On the one hand, this system will work in perfect unity when vata, pitta, and kapha are enjoying a complementary balance. However, pragya parad and the compounding nature of the mistake of the intellect upon the physiology can introduce considerable fragility into this otherwise invincible system. The true beauty of the physiology is neither the richness of all the physical possibilities, nor is it the trappings of the aesthetics, but rather in the subtlety and fineness of the Shrotas and their mulas. An understanding of the mulas demonstrates the holistic underpinnings of the Ayurvedic anatomy and physiology and highlights the possibility that the Vedas do live within. The Pranavata Shrotas, Rasavaha Shrotas, and the Anavaha Shrotas are all intimately connected by the heart and alimentary tract. This functional relationship identifies how prana and the five elements move into the physiology and how they are to be most efficiently transferred and transformed in such a way that maintains the reverberations of consciousness in a state of wholeness that culminates in the production and maintenance of ojas. In short, the Pranavaha Shrotas takes in prana and passes it to the Rasavaha Shrotas and the Anavaha Shrotas. The Anavaha Shrotas also passes prana to the Rasavaha Shrotas. This pass, so to speak, only happens by virtue of properly functioning Jataragni and Dhatu Agnis. If there is any compromise in the function of these transformative elements, the resulting Agni Dushti will decrease the Shrota-Shuddhi condition to some degree. This will cause dysfunction within the physiology. The dysfunction leading to this Shrota-Shuddhi condition is rarely congenital or acute in nature. Environment can have its effects on the transformative power of Agni, without a doubt. However, karma, impure air and food, and excess physical activity can largely be managed as a matter of dinacharya. Rather, the state of Agni will be determined to a much greater degree by the state of mind, the Manavaha Shrotas. The Manavaha Shrotas, the reverberation within the Manavaha Shrotas will be a determining factor in the state of Agni. There is an element of nature versus nurture in the maintenance of Agni within the physiology. Depression, tamas, anxiety, rajas, and relative bliss, or sattva, as state of mind and therefore state of being, will determine Agni to a much greater degree than whatever mediocre pacifying remedies we choose to deliver. In short, dinacharya is very important in maintaining the nature of Agni. However, transcending the mind in order to nurture the Agni would simply be better. This client is described as having a vata indigestion condition, possibly a Vishtabdijurna. This would explain the tendency towards vata disorders that are listed. These vata disorders are indicative of Pranavaha Shrota Dushti. The variable nature of the Visham Agni must be contributing to an increase in ama production at the level of the rasa dhatu. The mala of the rasa vahashrotas is kapha. This kapha will be produced in excess as a result of compromised digestion. In a vata adjournant condition, an excess kapha can be considered as ama. This excess kapha will primarily accumulate within the kapha stan and act as the causative factor in the remainder of the dysfunctions. The vataja pratashaya condition will create an environment in the lungs, ears, nose, and throat and sinuses that will be conducive to further increases in kapha as a result of increased kapha from ama rasadushti, leading to sneezing, allergies, and nasal congestion or colds. The dry cough, likely of some chronic nature, is an attempt by the physiology to move excess mucus from the lungs to the nearest point of exit, being the mouth. However, this mucus that is making its way up the trachea little or none of it will make its way to the mouth for expectoration, but rather will be swallowed down the esophagus, polluting the anavahashrotas again, and subsequently sending more poorly formed rasa and excess kapha into circulation, somewhat of a positive feedback situation. This positive feedback may in turn further aggravate fine systems like the vestibular cochlear apparatus, which determines balance and is itself located in kapha stan and susceptible to further accumulation of ama. Ama would definitely be the culprit in this vertical condition as well. The simple diet for mitigation of these symptoms in this client, I would have them favor light foods and lukewarm drinks. I'd have them avoid heavy foods, ferments, foods that are too hot and too cold, sweet and sour, bananas, dairy, alcohol, and cold drinks. Anything that increases that kapha quality. I would recommend that this client would liberally utilize ginger to clear the sinuses and specifically stimulate the agni, and liberally utilize black pepper for the dipana and pachana properties and to provide vata and kapha balance. Once the condition improves, I might have them use ginger and pepper somewhat slightly less, and perhaps pipali slightly more.